Welcome to My Therapist is Out. Each episode, we talk with a therapist from Open Space Therapy Collective or LGBT community members about mental health and building community. I'm your host, Renae Johnson, licensed therapist and founder of Open Space Therapy Collective, where we are your hub for queer and trans mental health care. As we dive into today's topic, please keep in mind that this is a mental health podcast. We will talk about sensitive and difficult issues that are not appropriate for all audiences. Please take care while listening. Welcome back to My Therapist is Out. I am so excited. We have our therapist, Ernesto Martinez, with us today, and we are talking about how mainstream therapy often fails marginalized clients. And this is a big episode, but I am so glad that you are here with me to talk about it. How are you doing?
I'm excited to be here. Yeah, I'm doing pretty solid today. You kind of introduced me a little bit and let me tag on. So yes, I'm Ernesto. I'm one of the therapists here at Open Space Therapy Collective. I use he, they pronouns. And this topic is very close to part of the motivations of why I even decided to be a therapist. So I'm excited to chat.
Yeah. I can't wait to explore this with you. Before we totally dive in, maybe we can start by setting the groundwork a little bit of what we mean when we talk about mainstream therapy. When you hear mainstream therapy, especially as we're thinking about who mainstream therapy serves and who it doesn't, how do you think about that, or how do you define that for yourself?
Yeah, when I think of mainstream therapy, I think of this dynamic that when I first even participated in therapy still really rang true for me as a person in the client chair, which was there's this expert role, right? There's the expert, which is the therapy or therapist in the room. And then there's the client, me at that time, who is very much coming in with, I don't know why, but there seems to be something wrong. And here's this expert who knows all the answers. And part of those answers, I was assuming, were very like black and white. Now when I reflect back, like frameworks or ways of understanding what is healthy and what is unhealthy. A lot of my own individual experiences seemed like irrelevant to what standards of health meant in like a more individual sense. Like I thought the standards of health and what it meant to be a healthy person when I'm talking about mental wellness was aside from my own individual ideas of what health meant for me.
That's a perfect starting point, because it's the power dynamic of the therapist knows what's up and you're coming in and being like, okay, teach me who to be and how to be. It doesn't work, right? That's like a very like black and white, and there's only one way to be. And it defines health before the person that you're talking to even walks in the room. And we get that a lot with the clients that come in, and thankfully we're getting it less, but that's like, okay, I need to be healthy. I need my relationships not to be toxic. I need to not be anxious avoidant. I need to this. And it's all of these things that are like, I need to fit in these little boxes that I've been told or are prescribed ways of what health looks like, instead of, hey, who are you? What is your experience? What is your wants? What does this feel like for you? What is your cultural background? What is the dynamics and relationship styles and all of these things? Mainstream therapy doesn't allow for that.
Yeah. Just hearing you reflect back onto that, I'm thinking about like younger me and navigating therapy as a client, and now I'm the still a client of my own therapy, but also a therapist. So a therapist who goes to therapy. Yeah, a lot of stuff is bubbling up. A lot more questions that I'm hoping will fit into our conversation.
Let's also define what a marginalized client is. as you're pointing out, like there is not one size fits all for health. There is not one size fits all for what a marginalized client could be. Who comes to mind when you think about marginalized clients?
Good question. And I'm thinking about folks who have a position in society that either sometimes becomes a lot more clear as, or maybe doesn't. Maybe it's a lifetime journey, but can be seen as something aside from a typical or quote unquote normal experience when they think about their own experience. So for me, I can maybe use myself as an example in this. I identify as a first generation child of immigrants. I am Latine or Latino, and it was much later on in my schooling, after going to school here in America, being the first one in my family to go to school here in America, having this kind of comparison of at home, these are our norms. We're very collectivist. A lot of the framework or dynamics in our relationship are very attuned to each other. I use the term community oriented. And then out in school, out in the world, even when I first got my first job, things seemed a lot more individualistic. The responsibility of managing, for example, anxiety, of navigating schoolwork, performing, seemed to be put on the individual, as opposed to, this environment that I'm in isn't really cultivating towards my specific ways of navigating information or processing information. And that made me feel as something aside from a typical or normal individual. Then you add the extra layer of a queer person who identifies as gender expansive and also identifies as neurodiverse. And so then that later on, those layers seem to be a little louder and louder.
Yeah. I love that you're bringing in the multitudes of identities that we all have, right? Or, intersectional identities is we're never walking in with just I am this one thing, that doesn't exist. And so there may be parts of us that can work well in a classroom or in a traditional therapy situation style, but then there's all the rest of the parts of us that don't. Also as a, neurodivergent person who is a queer person who has always wanted a different lifestyle than what was assigned to me, and the things that didn't work. The feedback of the first few steps into a therapy room as a client or into a classroom as a client were we see you are this thing. And then 3 sentences into a conversation, it was instantly oh no, you need to change everything that you're doing and thinking about so you fit this box in the way that we think you should be. And that goes across the board. And so there's we can do the buckets of marginalized clients of race, culture, gender, sexuality. But I like that you're bringing in that there's more than that the way that your family ebbs and moves and flows, and then all of a sudden you're put into a different environment and that big shift doesn't work anymore. And then different experiences for you come up, and the importance of teachers and therapists meeting you where you're at and how you function is really, really important for anybody to grow, thrive, flourish, all of those things. And it instantly gets halted and goes the other direction when you're fit into this box of what healthy is.
Yeah. Yes. Or, what it means to, this can go into so many different directions, or what it means to be a good student, or what it means to be a good person in this society. There's a lot of standards that are kind of ambiguous to some people. And then standards that, and for other people, those same standards are not even a thought. They're not ever having to reference something different. And that could be for many reasons. But for this example, I'm thinking about like, maybe it's because they are part of what that standard would be. So there's no need to second guess, do I fit in or not?
Yeah, they're already part of the standard, which is a great way to segue into where does therapy come from? Because I think it's important for us to have this conversation or acknowledge like where this base of, at least in America, we think of mainstream therapy or what is most often thought of as therapy, where it comes from.
Yeah. And earlier I said, in this conversation, I was having a lot of questions popping up for me. And maybe these questions can lead towards that defining a little bit more of where does therapy come from? Because it seems like such a big thing. And then I know we're talking about, when I hear therapy, I'm also thinking about mental wellness. And I'm thinking of this idea of standards around mental wellness. So, for example, sometimes the standards of what a healthy individual is are already defined constructs that we're kind of like talking around. And at some point, those healthy individual constructs, and in many regards, I think, especially when we're talking about like diagnosing within this role of a therapist, a lot of the times we're going off of what is unhealthy as opposed to this is what is healthy. It's like, here are some things that defined a quote unquote unhealthy experience. I'm thinking of these bigger questions of like, who gets to define what is normal? If we're talking about just traditional Western therapy, it is my assumption that most therapists at some point have come across the DSM-5, which is the Diagnostic Standard Manual, which has a lot of characteristics on how we conceptualize what's going on for someone. But someone had to define that those characteristics were related to some kind of standard of normality,
which has been historically a group of cis het white men.
Mm-hmm.
And people who are not interested in collaboration. And so when we'll get messages of like, oh, the DSM is coming out, and then it's delayed 5 years because there's so much infighting that's happening. There's now some women on the DSM board, but it's come from this very Freudian space of this is unhealthy and healthy. This is anything that doesn't fit this like Eurocentric system that prioritizes the idolization of the white straight man is sick and wrong. And
yes,
I know you and I and like our group at Open Space and many of our other colleagues are trying to be like, can we stop doing this? This isn't working. But that is still the main prevalent mode of what mainstream therapy is. I think that there's a space where it's infiltrated TikTok and Instagram mental health things because those are all quick sound bites of what neurodivergent is and isn't, what a healthy relationship is or isn't, who's toxic and where you should kick it out, and why not. You have an anxious attachment or avoidant attachment. It's all of these like quick little sound bites. You fit in this box. Here's your box. Okay. And that is, well, I love that mental health is being talked about more. I think it's great. Obviously, we participate in that. I am often concerned about the detriment of going backwards into this mainstream, old school mental health or therapy space because people are looking for the box and the tag and the label instead of being able to be in that gray space.
100%. I think this gives a lot more rich language to the definition that's coming up for me right now when I think of like traditional therapy and what is traditional therapy and therapy in general. It's maybe there's an underlying layer since we're bringing in the DSM-5 and people making decisions around normality. It is how do we, mental health professionals, integrate you or people or clients to assimilate into the broader society, right? So there's like this kind of dynamic of there is a broader society that aligns with characteristics that are normal. Sometimes those characteristics are also kind of really closely tied into productivity and how do you produce and how do we support you in integrating or assimilating into that society. I'm hoping that's making sense. And I'm having thoughts of like how specifically how we shift away from those things. But I do want to add maybe a layer to this integration or assimilation into broader society. I'm also thinking about the idea of who gets diagnosed and then following that diagnosis, they get support versus who gets criminalized. And those behaviors that could fit into some kind of diagnosis and then follow up with support. In some other identities, I'm thinking about race specifically, who gets criminalized for those same standards.
I like that you're bringing it up. Let's pin this for like 10 minutes from now.
Yes.
Because I think it's really important. But before we go there, can we talk about what would be some experiences of a marginalized client going to therapy, going to a mainstream therapist, and feeling unseen, unheard, misunderstood, invalidated, fill in the blank? What are some cues for people who are like in therapy and being like, something is off?
And I'm thinking back to my own experiences where something is off. It's if there is a layer or a feeling that maybe I don't even have words to explain, but I'm feeling like I need to overly educate or overly correct my therapist's feedback or conceptualization around my experience, especially if it sounds like that language seems way too objective and maybe is not using the same language that I'm using. One example might be anxiety, but I'm not using the term anxiety. I'm using like things like, oh, I feel really on edge a lot of the time when I'm doing my homework. If I met with like, okay, I'm hearing you're feeling anxious when you have to produce some kind of work from school, and then goes on with like more clinical language stuff, then I might be like, I don't know if I'm ready to use the term anxious yet. I'm imagining myself, younger me, not even having that language and being like, I don't really know what that means. I don't know if that's useful for me right now. I'm just feeling on edge. So I'm trying to highlight is how the language that you're using, how that's also popping up in the feedback that you're receiving from your therapist.
Yeah. That's also like in that example when you're saying on edge and the therapist is coming back with anxiety, they are assuming that they know what you mean by on edge. Like on edge could mean 500 different things.
100%.
And so they're jumping to their language repertoire instead of staying with you in yours and exploring what that is and what that means and what that experience is. Like we use anxiety and depression way too much. And I'm honestly so sick of it because it gets used as umbrella terms and like, oh, it's just anxiety and whatever, ignore it. Instead of being like, okay, on edge, like, what does it feel like in your body? What has this experience been like for you before? Is this new for you? How does this relate to XYZ, in the deep dive that can go in there. Mm-hmm. And the mainstream therapist will go quickly to, on edge means anxiety. And so let's talk about general anxiety disorder. And pulls it back into the book and the diagnosis versus what the experience is.
I know that was a really specific example, but I'm pulling from so much of the conversation already, just like past experiences for my own self. yeah, the way that you reflected that really, really ties in.
In thinking about what some of the clients who have come in have said from other therapists before they come and see us, especially our queer crew, is there's usually a session or two where they're like watching us to make sure that we get it. And then there's like a big sigh of relief of like, oh, fuck, I don't have to explain my poly relationship. I don't have to explain that my gender identity and that exploration. I know that you are going to help me with the thing I'm coming in for and not assume that I'm coming in for my queerness. Like there's all of these things that I'll see with clients that as just a mainstream therapist completely missing the person who's sitting in front of them and just going, oh, it's a queer person who's gender expansive. So it must be one of these three things. We're going to focus on that.
Right. Yeah. Yes. So this idea of you're not using this language, and on my end, what's coming up for me is like this idea of then, in an effort to provide services to that client, folks might also rely on like overgeneralizations of individuals too. As a client, you might even be tapping into some of the over generalizations that are coming back at you. And then that might bring up a lot of stuff within you that's kind of hard to even put into words sometimes, being like, for some reason, that doesn't feel good to hear. I know the intention might be to try and understand me more or my experience, but it's landing differently. And it has to do with like the language that that client might not even be using, or it just doesn't make sense to them.
It makes me wonder how often a marginalized client of whatever identity is sitting in front of a therapist and not like feeling that something's off, can't quite pin it. And like using queerness as an example, being in that relationship dynamic for a while actually reinforces any internalized homophobia or internalized transphobia instead of actually doing like empowerment work, acceptance work, or whatever it is that the person is going to therapy for. Do you have thoughts on that? That is just like coming to me as we're talking.
Yeah. Yes. And this ties into like the shift that I was maybe trying to work towards. If traditional therapy is focused on how to integrate or assimilate you into a more normal society, using quotes, because trying to highlight that, like, that might be the function of the term broader society.
Mm-hmm. Yeah, good point. This is an audio medium, so air quoting around like healthy and normal.
Right. Maybe the shift is towards how can we support you based on your own goals, your own values, and bridge that support to include the understanding of your own lived experience in a world that may not be designed for you to navigate comfortably and confidently. So in a way also where it's like validating that the world that you have experienced might not have been designed for you to navigate in a way that feels confidently or comfortably you. And so then how do we integrate your own goals and your own values in making a bridge that would support you in making decisions or experimenting with different ways of being when going forward out of or after therapy or in your therapy journey. Yeah, sorry, some of the words just kind of mashed up for me.
No, you're good. I'm with you. It makes me think one of our therapists is working with a client of multiple identities, and a lot of the work is helping the client not pathologize themselves because they grew up in an environment where they were not the quote unquote norm. And so they were pathologized by the adults around them over and over and over again. And so a lot of the work is, there's nothing wrong with you. We need to figure out what it is you want and what works for you and what doesn't work for you.
Yes.
It's sad to see how deeply internalized the like something's wrong with you just for existing can really happen, and how that can be reinforced by mainstream therapy.
100%. Yeah. I think what you're like a layer of what you're sharing in that example is, if I'm going back to like diagnosis and something that we pinned for later, what if the importance of a diagnosis, getting a little clear on that, especially if someone's already kind of internalized and pathologized some of their behaviors, that kind of aligns to like diagnosis talk, right? What is the importance of presenting characteristics with a consideration towards adaptation to the environment, which that example I feel like is trying to highlight, right? So an environment that was either hostile or not designed to comfortably navigate in, right? And then pathologizing the responses of that person, and in a way that they have to take on the individual responsibility towards managing all of that or fixing all of that. That can be maybe part of it, but it doesn't have to end there. It can also continue on with other stuff surrounding their own goals, their own values, and how they want to or imagine themselves to navigate the world.
Yeah. Can you, since we're unpinning this, can you talk a little bit more about who gets diagnosed and who gets criminalized? Because I think it's really important. And kind of how that process happens within the scope of mainstream therapy, and probably a little bit of education, since it is something that happens early.
Yeah. This gets wrapped up into parts of identity that people have no say over, like the race, gender assigned at birth, their economic status, and other marginalizing identities. Based on those, you might be kind of pushed into certain pipelines that might lead to a diagnosis that then leads to support. And if we're thinking about having access to even going forward with that support, that might lead to that person navigating the world in a way that feels comfortable and supportive for them after getting pushed into that pipeline. And then for other folks, they might be pushed into another pipeline by, again, stuff outside of their control. So I'm thinking about schooling and, if you have certain needs and aren't able to express those needs, the adults in the room or the way support is set up in the structure of that school might lead you into a lot of what is a snowball effect of potentially being pathologized around, oh, you're not a good this, or you're not a good that, or a lot of these behaviors are your issue, right? People might internalize that. And because it's such a big snowball effect in this very specific example, if it starts in the school, that person might, throughout their schooling, be kind of like pushed into a pipeline away from getting the support they need and more towards over pathologizing their behaviors that might be very valid responses to navigating a world just not built for them to get supported. And as they transition into adulthood, get criminalized because of those behaviors. Thinking about if that example was maybe too heady.
No, I think, it reminds me of, there's a recent Trevor Noah podcast, and I'm so bad with names and I am deeply sorry. They had a professor on who talks a lot about this and how the world isn't necessarily, the world isn't made for certain people. And that's where kids get expelled, or we're so focused on standardized testing that it's set up to make certain people from certain backgrounds and et cetera fail.
Mm-hmm.
If you don't listen to Trevor's podcast, highly recommend. Obviously, he's famous, so he doesn't need our recommendation, but he's had some really great guests on this year. But it does make me think. We have a colleague, and I'm not going to out her because I don't know that she would be okay with that. But generally speaking, we have a colleague that works in residential treatment for teens. And something that we hear from her often is there are typically the white cis kids get a lot of passes. If they act out or something goes wrong or whatever it is, all the things that teenagers do, they get a mild punishment. Maybe their phone gets taken away. They can't go on an activity. They're grounded, whatever happens. And then they stay. And that continues to happen for that kid, where one of the Black kids or the darker skinned kids or the trans kids get immediately kicked out, or they get bullied a little bit more. They get dismissed more. Then they don't get those freebies. And so by the time you're in residential treatment like this, things have gone really wrong already. And so to continue to get the no, you're wrong, leave, instead of, hey, you broke the TV or, whatever the example is, what's going on for you? Can we sit down and talk about it? They're getting continued to push down the criminal pipeline, because what happens after residential treatment is pretty quickly juvie and, the next XYZ issue.
Yeah. And I'm thinking about taking a far step back, and in my example, maybe aligning really well with these real world experiences, where part of the root experience in then, going forward and not getting the support, there's this layer of having to either not having a space where you don't have to deny parts of yourself or disguise parts of yourself or parts of your experience, and not having a space where you don't have to hide, deny, how that can also really impact how a person will try and manage not having the ability to be, I was trying not to use the language, being seen. But being seen is really important. It's like, it's not the root cause, but maybe part of that experience, and pipelining and how that all goes is just like not feeling seen or understood, or not having environments where you and your experience isn't being taken into consideration when it comes to the way that you are presenting or navigating the world day to day.
Yeah. And that, especially for kids, gets internalized as not that something is wrong with the environment or something is wrong with a behavior, but it gets internalized as I am wrong, which is heartbreaking and unfortunately happens all of the time for exactly what you're describing.
Yeah.
Let's pivot to what therapy can be. If we step away from our mainstream therapy, which obviously you and I are not fans of, and into therapy that can be effective and flexible and actually healthy, without air quotes, what does an affirming, inclusive therapy look like?
Oh my gosh. Okay. I'm going to use a really specific example because now I'm tapping into like, okay, what happens in the room then, right? In the therapy room. And I like to start all my sessions with an accessibility check-in at the beginning. So to set the tone. And I continue to do this. And, sometimes clients are like, well, I'll explain why I'm doing it. And sometimes, it's like, oh, I don't really need anything. And then one session, it'll really hit and they'll be like, oh, yeah, I am going to be sitting down or expected to sit down for therapy for 50 minutes. And what I'm trying to highlight with that question is you don't have like that expectation of what therapy looks like for today doesn't have to be that. And so it's thinking about like spatial needs, positionality needs, even climate needs, right? Like, oh, it's too cold for you today and you're really trying to get into your body. You need some warmth. Okay, we can shift that.
Can you give an example of what an accessibility question is for people who don't know, or how you approach that with the clients?
Yeah, I use it really in a way that's, I hope, sounds really easy to understand, where it's, what do you need to be in therapy for 50 minutes today? And then sometimes people might just be like, oh, no, I don't. No, I'm fine. And then sometimes just that question be like, oh, I was just rushing here. Can I take my shoes off? Can I, put this blanket on? Can we like dim this light a little bit? Yes, and yes. Right. So it's like, we're already doing that. I sometimes too, it's hard because I'm thinking about like individual people and then they themselves, building off of those needs. Sometimes people are like, oh, I might want to stand at some point, or I might want to lay down on this couch at some point. Okay, cool. Mm-hmm. Great. Mm-hmm. Yeah. And so that's one like real, like in my head, such an easy way to kind of shift from traditional therapy being like, we're going to sit across from each other in this room and talk. It can be something different from that. It doesn't even have to be talk oriented. Sorry. Yeah. I got real fired up with that example.
It's a great example. And you're right. For the therapist, it is so easy for us to do. Hey, what do you need? Hey, before we dive in, how are you feeling? What do you need? And yes, you can eat while we talk. You can pace while we talk. You don't have to look at me. You don't want me to look at you. You want something to fidget with. You want to, world is your oyster. And starting with that baseline of like, hey, you as the human that is coming into therapy, what do you need? Not, I am the therapist, you come to me.
Yes. And I think this kind of ties into the question and the different parts of my answer to that question. And so also this like shift towards understanding mental health in general as a personal journey. And each person experiences of wellness vary. And so moving aside from, I'm the expert in the room and I know what wellness is, towards really stepping into, each person's experience of wellness is going to be different. And all individuals deserve equal consideration to their unique experiences, regardless of their motivation, expressed ability, even expressed desire to engage into wellness. And I think that kind of relates to this idea of maybe the motivations or self-expressed inabilities or desires might even relate to these already defined constructs of what a healthy individual means. And I'm doing air quotes for our audio listeners. Yeah, there's like to already start and get curious around that. Maybe later on too, folks might be on their own terms, be like, oh yeah, I do have preconceived notions of what a healthy individual is. And that just doesn't apply to me.
How does a therapist explore somebody's values and goals in therapy from a way of not centering, quote unquote, traditional health? What are some ways, especially like early on when we're treatment planning, that's part of like our ethical guidelines that we have to do. Also, you want to know why the person you're sitting with is coming and what they want help with. How do you do that in a way that isn't mainstream focused, but is client focused?
One really easy way, I think, is person first language. So this idea of this person has anxiety, as opposed to this person is living with anxiety. It's like kind of a shift that's trying to move past, like, they have to own that and all that comes with it, towards I live with this, but it doesn't define or have to define me as a person. So that's kind of like language shifts on our end too.
Bouncing off of that, there's a lot of destigmatizing that we do, and that I think is really important, is we're not trying to make your feelings go away. We're not trying to make your experience go away. It is like your feelings and your experience. Let's understand and collaborate and empower them so you and all of these parts of you can work together in a way that feels good for you and your experience and what you want. I think our cishet white colleagues hear person-centered and was like, skim the top and go, I'm a person, they're a person. Okay, great. Treatment plan, your anxiety. Let's check it off and get you some meds. Where it's much, like you're saying, it's much deeper than that. Like let's name experiences you're having, and that is still not the person. Like, we want to know the person and your experience and what's happening. And if you're sitting with a therapist who feels like they're skimming the surface, chances are you're not going to get great therapy, and you're not going to get very far with them, because they're going off of textbooks versus getting in and getting to know you.
Yes, right. Maybe in the dynamic, there's this sense of like offering solutions a lot. To me, that might be something to, if you're not feeling very good, or finding yourself like taking on those solutions that are being given, and just, it's like, oh, this isn't working. Why isn't this working? And then further kind of thinking like, oh, there is something, this must be around me. Maybe that's a moment to also pause, if this reaches your ears, to also be like, oh, wait, I wonder what is the framework that I'm receiving this care through? Are my experiences being pathologized, or is there some kind of consideration towards, the focus on the environmental factors that I've had to navigate through, and the personal adaptations that have allowed me to navigate my environment, rather than the diagnosis of I have anxiety.
You mentioned earlier therapy that's not talking. Can you talk a little bit more about not talking in therapy, and what that looks like, and what the effects of that are? Because I think, there's like art therapy, and you're like, oh, great, we'll color together. That's not what we're talking about. You can go do crafts with your friends, and that's great. There's space for that, but that's not what you're referencing.
Yeah. Yes, I'm talking about how, talk-based therapy to me really aligns super easily with mainstream therapy. And that's great if that works for you. I'm not trying to rag on that. I'm saying, and if it doesn't work for you, and it doesn't work for you, there are other options. For example, therapy that really just more focuses on perhaps sensations that are coming up for you in the present, in being in the room with a therapist. And if the dialogue is kept at a minimum, we're kind of we're chiming in on what's going on inside for you, right? Sensations, temperatures that are coming up for you, maybe even images that come up for you when you're thinking about the experiences that you're wanting to explore in therapy. I like to tap into giving options that we can talk about this, and at the same time, your mechanisms of experiencing and understanding and processing what you're wanting to can also include moments of, okay, the dialogue is only focused on, I'm seeing a lot of images coming up for me when I'm thinking about this one thing I wanted to talk about, and actively not talking about it, exploring it differently, right? Oh, I'm feeling some warm heat in my belly today. And some of the images that are coming up for me are the feelings of feeling really on the spot when I was asked to, perform something the other day. That's what's coming up for me right now. Okay, what are some options that you're wanting for yourself with that sensation? Do you want to explore that warmth? Do you want to move on to something different going on at your body at the same time? Do you want to be reminded of sharing space in this room right now with another body and what comes up from there? Just kind of giving options, not all at once. I'm just kind of giving framework with just like options that might pop up in a sensory experience.
Yeah. We talk about it with our clinical director of like bottom up versus top down. And
yes,
where when we are just doing talk therapy, and again, if it works for you, no shade, but when we're thinking about mainstream therapy, that's typically where it lives, and you can skim. This is the theme that's coming up. Just, I'm fine. Things are fine. I know this. I understand that person is bad for me, but I still am around them. I guess I have to fix my attitude or behavior or whatever, instead of being like, okay, let's slow down. Let's think about, imagine yourself being with this person that you're struggling with, and then going into what you're talking about. Like, what are the sensations? What are the feelings? What other memories come up? What other images come up? Because that bottom up approach allows for the whole human and all of our parts to have a buy-in to the experience, instead of letting the like cognitive thinking brain run and dictate the show. Because while it's great and we love that part of ourselves, it can't be in charge. It needs to be a collaborative process.
100%. Yes. That reminds me, just like to tag on to my example in maybe sensing in what could have maybe been a conversation around like, I feel anxious and I know I feel anxious because of this, to then being like, okay, I'm having these images come up for me and I'm remembering this like warm sensation and now I'm feeling it again right now. Okay. Yeah. And if I'm like sitting with that and just letting more images or other ways of experiencing the sensation come up, maybe that leads to a more, I don't want to use the term aligned, but just like a more like precise way of talking about that anxiety, in this way of like, oh, it's less of this big term or big nebulous thing being anxiety, and it relates to stuff that's going on in my body in maybe this very specific situation. And maybe there's a pattern there that I can explore. Maybe after this session, I'm a little bit more attuned to knowing, oh, when I get that warm feeling, I might be feeling, it's giving me a signal that there's some stuff going on, either in my environment, maybe in my thoughts, or the things that I'm seeing my brain stick to, align with this response that I'm getting. Okay, that's some good information there. I can even build off of that information. It doesn't have to end there.
We can continue to give 45,000 million examples. But
I really want to.
We'll stop ourselves. I do like where you're going in, okay, this is what's happening in the room after. What do I do after? And, max therapy is an hour a week, and there is so much more time and experience in life and relationships that people engage with and live in. What are some other healing spaces, relationships, dynamics, things can do that help heal, help you explore if your therapist isn't the right fit, if your identities aren't being understood, what to do if you are seeing a good therapist that's working for you, and how to bring that out of the room and into your life in other healing ways.
What's really sticking out in my brain right now is like also how your therapist brings in conversations of like, not just like what is wrong, but like what feels good, what is right too. And how that's maybe even if there's like a tone of like responsibility or something like that, of like, it is your thing to solve. Tapping back to my example, me as a young therapy client, knowing that framework of individualism when it comes to wellness didn't make a lot of space for my well-being tied into the collective health of my community and my family, and also exploring ways of like, how do I outside of the therapy room engage in community-oriented, interconnected, communal health, while I'm also attending towards my individual growth or individual wellness. There wasn't a lot of attunement towards my experience being less individualistic and more collective. I found now in this age, my community really feeds me and really adds to my own individual growth, my own individual goals. So just getting curious around how you're resourcing this idea of what feels good for you, what allows you to navigate your own growth, how that's being talked about in therapy too. When is it being brought up? Is it even being brought up? Or are we just talking about like issues and, frameworks that put a lot of the responsibility on just you?
Community is the biggest thing. I think most of our clients, and I'm generalizing, but I think it's true, come in feeling lonely. And it might be like they don't have any friends or community. It might be their people they're around are misunderstanding them. It may be that they struggle to find the people or know how to relate. But that community piece is, and this is a soapbox I will die on, is where real health and real vitality and real flourishing lies. And having those communities, family, friends, mental health, queer community, whatever culture you come from, being rooted in that community is vital. Well, thank you so much for talking today. I feel like I know you and I could probably talk for 4 more hours about this, but it's really important and it's really deep. And if you have a therapist, talk to them about this. If you're looking for a therapist, our crew is available. We're also happy to refer. And finding somebody who gets you instead of like skims over the top and is going down checklists and handing you worksheets and focused on your diagnosis and if you fit in or not. Good therapy is out there. So we're happy to help however we can.
I want to co-sign that. Yeah. You wrapped that up so well too. It was like, oh yeah, points were made.
Well, thank you, Ernesto. I appreciate you always and your time today. And now for your queer moment of joy.
Hi, where I work, I'm Cadence. My pronouns are they, them, he, him, and I work for Rainbow Hill Sober Living in Echo Park. And I'm the manager of the house. A recent moment of queer joy is spending time with my friend, Izzy, who I met at the house. And we went shopping, and we talked about art, and we talked about our passions, and we talked about how to, like, as queer people in sobriety, to manifest our dreams. And it was really beautiful and affirming. Yeah.
Thanks for joining us. If you're in California and looking for a therapist, visit our website at openspacetherapycollective.com and book a free intro call with one of our therapists. If you're enjoying My Therapist Is Out, please rate, review, and follow us on Spotify, Apple Podcasts, and YouTube. Do you know somebody who could use a little extra dose of queer community? Send them one of your favorite episodes of My Therapist Is Out and help our collective grow one listen at a time. My Therapist Is Out is an open space therapy collective podcast, and our podcast editing is done by Rachel Peltzer and Smash and Grab Studio. We'd love to hear from you about today's topic, so email us at info@openspace.therapycollective.com. You can find us on TikTok and Instagram at Open Space Therapy Collective. Thanks for listening.